Welcome to the Human Momentum Podcast. I'm your host, Erik Schabert D.O. If you are looking to optimize your health and avoid or failing that, manage and recover from the illnesses, injuries, and diseases that stop so many of us from moving forward through life, you are in the right place. It's my mission to make this podcast an essential, evidence-based resource for people like you who are looking to know what you can do at home to optimize your health and are looking to gather the information you need to get the most out of your relationships with your doctor and other healthcare professionals. Don't forget to smash that subscribe button if this is your first time here, and please remember to like and share this episode if you find it helpful or informative. Also, be aware that I read all of my comments and will attempt to respond to any questions from my viewers as it is appropriate. With that in mind, let's get on with today's episode. Hello, and welcome to today's episode. Today, I want to cover a topic that has become quite controversial and quite political in the United States, but I think is an important one to discuss, and I've been meaning to discuss it for some time, and that is public health. The COVID-19 pandemic brought public health into the general focus for Americans in a way that nothing else had prior, at least not since 1919. Certainly, public health has become incredibly politicized, polarized, and difficult to discuss in a rational manner since the COVID-19 pandemic. So I want to worry through some of these issues and hopefully give a apolitical, balanced analysis of the hits and misses of our governmental public health efforts over the last 5 years, and hopefully where we can get better. So let's start with a post-mortem on the U.S. response to the COVID-19 pandemic. Initially, I want to talk about lockdowns. Lockdowns and social distancing were the only tools we originally had to try and limit the spread of COVID-19 in the United States and limit how many people got sick and how many people died. So I can completely understand the rather aggressive national response that we had initially as COVID-19 began to sweep through multiple communities and deaths were piling up. We saw schools close, businesses shut down, parks and public areas completely restricted. And this went on for quite some time. Even after vaccines were introduced in the fall and early winter of 2020, we continued to see very draconian lockdowns, including complete school closures for months afterwards, even once vaccines were readily available for the entire adult population. I think this was a mistake. I think that not evaluating evidence and realizing that children were not a primary vector for the spread of COVID-19 and not realizing the amount of harm that was being done by keeping them home, both economic and to their education and emotional well-being. I think that was a real miss on our part. And I believe that if we had more aggressively evaluated the data that we had available and applied that as rapidly as possible to policy, that we could have had kids back to school much earlier in a lot of locations. We could have had businesses open a little bit earlier, and we definitely could have opened up our public spaces much earlier because we knew that COVID-19 did not spread readily outdoors. Okay, so at the same time, we also have to acknowledge that by reacting more slowly to initiate the first of the restrictions on people's movement, that we missed a real opportunity to minimize the initial inoculation of the American public to COVID-19. We could have reduced massively the number of people that got infected on the front end. We had a cruise ship full of people that were sick that were allowed to come into San Francisco. We had numerous individuals flying back into New York LaGuardia that we knew had been in the regions of China where the virus was present, and yet these people were not quarantined. They were not evaluated for evidence of illness, and they were allowed to circulate in the public. And sure enough, the areas where these people came back were the ones where the infection first spread most aggressively. Other countries such as New Zealand and Australia, and even if you want to look at it, China, were much more aggressive about isolating people that had potential exposure to the illness early in the illness. And by doing that, they severely restricted the spread of the virus early in the disease and had much more success at keeping COVID deaths to a minimum than the United States did. The next thing I would like to talk about are the vaccines and vaccine mandates. Certainly mRNA vaccines in general and the COVID-19 vaccine specifically have become a very controversial and very politically charged topic in the country. We've seen recent efforts to restrict research into mRNA vaccines and a directive from the CDC to restrict the individuals who get them. Some of this is appropriate, some of it is not. And I think we can trace the push for a restriction of mRNA vaccines and the distrust of them to mistakes that were made early in the availability of these vaccines. Initial research looking at the effect of the vaccines on the wild type or original version of the COVID-19 virus did indeed show that they cut the risk of infection substantially and therefore could restrict the spread of the illness. Initial recommendations, therefore, were to vaccinate everyone for whom the vaccine was known to be safe. And mandates were issued by multiple states accordingly. That eventually included school children and young adults. Well, very early in the availability of vaccines, we had information that the variants that were then circling were not restricted in their infectious spread by the vaccine. So we knew that the vaccine did not block the spread of these versions of the virus. And yet we continued to make recommendations for vaccination as though they did. This had real negative impacts because we were vaccinating individuals who had very little chance for benefit because the only real benefit to the vaccines was in preventing severe disease. So by vaccinating individuals who had an extraordinarily low risk of severe disease, we were causing potential vaccine injury-related harm without much benefit. And yes, every vaccine can cause harm. That is just a truth of vaccinations. The COVID-19 vaccines were not much different from prior ones in the rate at which they did that, but it still happened. And I have the utmost sympathy for anybody who ended up with long-term symptoms and long-term problems because of injury due to the COVID-19 vaccinations, particularly if you're someone who is mandated to get the vaccine that didn't really need it. And those things did happen. And especially considering the highest risk for adverse events with this vaccine were in individuals between the ages of 15 and 25, vaccine mandates for school-age kids, college-age kids, and young adults just didn't make sense. We knew that very early, and we did not pull back on these mandates, and that is where the problem was. Okay, next thing I'd like to talk about is another very controversial topic, and that is the potential origins of the COVID-19 pandemic. We know that it came out of Wuhan, China. The official narrative has always been that the most likely origin of the virus was a crossover from animal species in the Wuhan area to human beings and then spread from person to person due to a random mutation in the virus. I think we've had a lot of information come out since early in the pandemic, especially more recently, that casts serious doubt on that narrative. I think there is a lot more evidence that the source of the vaccine, the source of the COVID-19 pandemic was indeed the lab in Wuhan. It was a virus that was created using gain-of-function research and accidentally released to the public. The fact that the sequence of the virus came out so early from China, and we have all these communications between the CDC and researchers and between the officials in the CDC, including Anthony Fauci, suggesting that they were trying to squash the idea of a lab source of this virus, despite there being some real evidence that that might be the case, is very suspicious. And I think the fact that this question has been left out there in the public eye for so long without definitive evidence that pushes one way or the other, and the official narratives continues to be pushed that this was a zoonotic source for the virus, is very problematic and erodes public trust. Okay, and One of the last things I want to talk about is a lot of the reason for the initial policies we had is we were looking back to the last time a major viral pandemic hit the United States. And that would have been the 1919 swine flu pandemic. During that pandemic, cities that locked down and locked down aggressively did far better than cities that were much more permissive on movement. And that information was used to justify rather draconian lockdowns. But we have to remember there are some significant differences between the 1919 version of influenza that was spreading, primarily in that children were a primary vector of that virus, as opposed to COVID 19, which does not spread well through children at all. And additionally, it was a very different social era. There was not the kind of movement from city to city and communication between people face to face then that we have now. It made it much more possible to lock down a location. And once the viral spread within the community was initially contained, you didn't have to worry too much about people traveling in from another city and re-inoculating. That was not the case in 2020. So trying to use the same policies that worked in 1919 and apply them to 2020 probably didn't make a lot of sense. All right. Well, that covers most of what I wanted to cover, but I do want to refer folks to something that I was really referencing for a lot of this information, and that is the wonderful book, The Premonition, A Pandemic Story by Michael Lewis. It is a phenomenally well-written post-mortem of the COVID-19 pandemic and also some of the issues within our public health system. One of the major characters that he follows in the story is a physician by the name of Charity Dean, who, as a result of the COVID-19 pandemic, left the California Department of Public Health, highly critical of them, and started her own company, the Public Health Company. I would encourage people to check out the Public Health Company and what it's doing and read The Premonition if you want to be much better informed on this topic. Thank you so much. That wraps up today's episode, and I hope to see you again next time.